Hello, this is Dr. Emma Hitt Nichols, and I wanted to wish you a happy new year. Today is New Year's Day, the time that you're listening to this, or I hope you're not actually listening to this on New Year's Day. I hope you're taking the day off from all things work related. But I did want to put a podcast episode out and stay consistent. This is pre-recorded, so I don't think much happened this last week if you're listening to this on January 1st, but I would like to put out a report on an article. And I'm using an article from the Pharmacy Times that reported on 11 potentially practice-changing drugs that were approved by the FDA in 2023. And I also did want to include an additional approval that happened in December that I think was absolutely exciting, although maybe not practice-changing from a pharmacist perspective. I'll tack that on at the end of this podcast. And then the link to the Pharmacy Times article is provided in the show notes. All right, so the first one of the 11 mentioned is daprodustat, which is known by the brand name Casgevy, and that's manufactured by GSK, and that's an oral medication for treating anemia in adults undergoing hemodialysis due to chronic kidney disease. Unlike traditional treatments that rely on iron supplementation and erythropoiesis-stimulating agents, daprodustat stimulates red cell production by enhancing erythropoietin hormone production. Clinical trials have shown this agent to be comparable to ESAs in effectiveness. However, it does carry a risk of serious cardiovascular events, although one study found it non-inferior to ESAs in this aspect. Another practice-changing agent, according to the article, is taurolidine and heparin combined together. That's known by the brand name Defencath, and that's manufactured by CorMedix. That combines an anticoagulant and an antimicrobial agent to reduce catheter-related bloodstream infections in hemodialysis patients. It has shown significant efficacy over heparin alone, but the potential for hypersensitivity reactions and heparin-induced thrombocytopenia does need consideration. Another agent pointed out as practice-changing is lotilamer ophthalmic solution, XDEMVY, manufactured by Tarsus Pharmaceuticals. And that's the first medication approved for Demodex blepharitis. That's an eyelid inflammation caused by Demodex mites, especially prevalent in older adults. Clinical trials indicate significant mite eradication compared to controls. Another agent is zuranolone, and that's known by the brand name Zurzuvae, manufactured by Biogen. That's a groundbreaking oral medication for postpartum depression, and that acts as a GABA receptor agonist. While it shows promise in symptom relief, concerns include its sedative effects, potential breast milk transfer, and pending DEA scheduling, which may affect its accessibility. Another agent is gepirone, which is known as Exua, and that's manufactured by Mission Pharmaceutical Company. And that's a novel treatment for major depressive disorder targeting the serotonin 1A receptor. This agent, gepirone, offers benefits such as reduced sexual dysfunction, a common side effect with other MDD treatments. However, its comparative efficacy with other medications remains unclear. So, as you may know, the AMA Manual of Style is the main style guide used in the healthcare and pharmaceutical industry, which you may belong to if you're listening to this. I have distilled what I think are the most important things to know in a downloadable cheat sheet so that you can make sure that you get the basics of AMA style right in your work. To download this cheat sheet, go to learnamastyle.com. That's learnamastyle.com, and I hope you find it helpful. So in the realm of RSV prevention, several significant advances have been made this year. The RSV vaccine, adjuvanted vaccine, which is Arexvy GSK for older adults, shows high efficacy against symptomatic RSV infection. Also, RSV Pre-F vaccine, also known as Abrysvo, manufactured by Pfizer, is for pregnant women and aims to protect infants, showing a considerable reduction in RSV hospitalizations. Then also nirsevimab, ALIP, also known as Beyfortus, manufactured by Sanofi, is a monoclonal antibody for infants, effectively reducing RSV lower respiratory tract infections with specific recommendations for infants born close to maternal vaccination. Another agent they mention is clindamycin phosphate, adapalene, and benzoyl peroxide. Together, that's known by the brand name Cabtrio, manufactured by Bausch Health Companies. And that's a first of its kind triple combination topical treatment for acne, which simplifies treatment regimens and improves adherence. However, its clindamycin component poses certain gastrointestinal risks. Another practice-changing formulation that these authors mention is acetaminophen and ibuprofen, which is put together as Combogesic IV, manufactured by AFT Pharmaceuticals. And that's a new parenteral agent combining the two drugs and offers improved pain management and potentially reduces opioid use in surgical settings. Its comparative efficacy with separate administration of these agents is yet to be established. And the last drug mentioned in the article is vonoprazan, also known as Voquezna, manufactured by Phathom Pharmaceuticals. It introduces a new class of medication for erosive esophagitis treatment, distinct from proton pump inhibitors and histamine type 2 receptor agonists. This agent promises quicker onset and the potential for broader use in gastrointestinal disorders. And then the one that I wanted to add to this list, which I think is pretty significant. I don't know if it's practice changing because it's very specific and it's a gene editing therapy. And these actually are two agents, Casgevy for sickle cell disease, which is a CRISPR method, and then also an honorable mention to Lyfgenia, which was approved in the same week. And that's also a sickle cell disease treatment. So the podcast episode was from December 11th, 2023, just a few weeks ago. The FDA approved the two cell-based gene therapies for the treatment of sickle cell disease, Casgevy, which is also called Exa-cel, and the other is Lyfgenia, also called Lovo-cel. Casgevy was the first FDA-approved therapy using CRISPR-Cas9, which is a genome editing technology that earned its founders the Nobel Prize in 2020. So it's very exciting, I think. Casgevy is intended for one-time administration via a hematopoietic stem cell transplant where the patient's own cells are modified so that fetal hemoglobin production is increased. The other therapy approved was Lyfgenia, and that works by permanently adding a functional beta-globin gene to the patient's own hematopoietic stem cells through lentiviral vector gene addition therapy. The approval of Casgevy was granted to Vertex Pharmaceuticals, Inc., and the approval of Lyfgenia was granted to Bluebird Bio. All right, that's it. And so quite an interesting year at the FDA in 2023, and I look forward to reporting all the events that, well, most of them, hopefully, that take place in 2024 as I continue this podcast every Monday, and I hope it's helpful to you. Please do tell your colleagues about it if you think it might be of interest to them. And I also wanted to point out, I always want to point out that the news that I present in this podcast results from me searching the medical news every day and collecting the pieces that I think are most important, which of course is just my opinion. But it's also combined with 20 years of experience writing the medical news. And I wanted to point out that I have no pharmaceutical allegiances. No one is paying me for this podcast, although I do hope that if you or your company ever needs medical writing assistance, you'll think of my company, Nascent Medical, nascentmc.com. And should this podcast ever become a sponsored entity, I do promise that it will be really clear what is a sponsored commercial and what is not. All right. Thank you and happy new year to you. I hope that it brings all your goals and dreams into fruition. And I hope that one of your goals is to stay updated on the latest FDA approvals through this podcast. All right. Thanks so much.